Hey everyone, Dr. Mike here, welcome to the channel. Today we're diving into a rare genetic disorder called Alkaptonuria, sometimes referred to as black urine disease. Now you might be wondering, black urine disease? What is that? Don't worry, we'll break it all down for you. Alkaptonuria is a fascinating condition that can present some unique challenges for those affected. But knowledge is power, and understanding this disorder is the first step in providing support and care. We'll cover everything from its introduction to the causes, risk factors, diagnosis, and even touch on prevention and precautions. So let's get started. So what exactly is Alkaptonuria? In essence, it's a rare inherited disorder. This means it's passed down through families, and it affects how your body processes certain amino acids. Amino acids are the building blocks of protein, and we get them from our diet. Now there are two specific amino acids, tyrosine and phenylalanine, that people with Alkaptonuria have trouble breaking down completely. This leads to a buildup of a substance called homogentisic acid in the body. And this buildup, my friends, is what causes the characteristic symptoms of the disorder. Now, you might be thinking, okay, Dr. Mike, are there different types of Alkaptonuria? And that's a great question. The simple answer is no, there's only one type. It's caused by a deficiency in a specific enzyme called homogentisate 1,2-dioxygenase. Think of enzymes like tiny workers in your body, each with a specific job. This particular enzyme is responsible for breaking down that homogentisic acid we talked about. But in Alkaptonuria, this enzyme isn't working properly, leading to that buildup and the associated health problems. Let's get down to the root of the problem, the genes. You see, Alkaptonuria is what we call an inherited disorder, meaning it's passed down through families. And the culprit here is a gene called HGD. This gene carries the instructions for making that crucial enzyme homogentisate 1,2-dioxygenase. But in people with Alkaptonuria, there's a mutation, a kind of spelling error in this HGD gene. This error disrupts the production of the enzyme, leading to the inability to break down homogentisic acid effectively. It's like having a glitch in the blueprint, leading to a malfunctioning machine. Now let's talk about who is at risk of developing Alkaptonuria. This rare genetic disorder can affect anyone, but certain factors increase the likelihood of its occurrence. Remember how we said it's an inherited disorder? This means that the condition is passed down from parents to their children through genes. Well, the primary risk factor is having both parents be carriers of the defective HGD gene. This gene is responsible for the production of an enzyme that breaks down certain amino acids in the body. It's what we call an autosomal recessive condition. This means that the disorder only manifests when a child inherits two copies of the mutated gene, one from each parent. This means that a child needs to inherit one copy of the mutated gene from each parent to develop the disorder. If they inherit only one copy, they become a carrier like their parent, but they typically won't show any symptoms. Carriers have the potential to pass the gene to their offspring, which is why genetic counseling and testing can be crucial for families with a history of Alkaptonuria. It's important to remember that Alkaptonuria is rare, and having a family history doesn't guarantee a child will inherit the disorder, but it does increase the likelihood. Understanding these risk factors can help in making informed decisions about family planning and health management. Early diagnosis of Alkaptonuria is key to managing the symptoms and preventing complications. This rare genetic disorder can lead to severe health issues if not detected and treated promptly. So how exactly is it diagnosed? Let's delve into the process. Well, it usually starts with a simple urine test. This test is crucial because it can reveal the presence of homogentisic acid. Remember how we talked about the buildup of homogentisic acid? This acid accumulates in the body and is excreted in the urine. In Alkaptonuria, this acid is present in much higher levels than normal, which is a key indicator for diagnosis. Doctors can also use genetic testing to confirm the diagnosis. This is particularly useful for identifying the specific mutations involved. This involves analyzing a patient's DNA to look for those mutations in the HGD gene, which are responsible for the condition. In some cases, imaging studies like X-rays might be used to assess any joint damage that may have occurred due to the buildup of homogentisic acid crystals. These crystals can cause significant wear and tear on the joints over time. Now the big question, can Alkaptonuria be prevented? Unfortunately, as of right now, there's no known way to prevent this genetic disorder. However, That doesn't mean there's nothing we can do. Early diagnosis and management are crucial in mitigating the symptoms and improving the quality of life for those living with alkaptonuria. While there's no cure, certain lifestyle modifications can help. Patients are often advised to avoid high-protein diets, as this can increase homogentic acid levels. Certain medications might also be recommended to manage pain and inflammation caused by joint problems. In conclusion, alkaptonuria is a lifelong condition, but it doesn't have to define a person's life. While there are challenges, understanding the causes, risk factors, and management strategies can significantly improve the quality of life for those affected. Early diagnosis and proactive management are key. By working closely with healthcare professionals, individuals with alkaptonuria can lead fulfilling lives. Remember, knowledge is power, and the more we understand about rare disorders like alkaptonuria, the better equipped we are to support those living with them. That's it for today's deep dive into alkaptonuria. We hope you found the information insightful and useful. Thank you for watching and being a part of our community. If you found this video helpful, please give it a big thumbs up and consider subscribing to our channel for more informative content on health and well-being. Your support helps us create more valuable content for you. We love sharing our knowledge and helping you better understand your body and the world of medicine. Our goal is to make complex medical topics accessible and engaging for everyone. Don't forget to hit that notification bell so you don't miss any future uploads. We have a lot of exciting content planned, and we don't want you to miss out. And as always, if you have any questions, feel free to leave them in the comments below. We love hearing from you and value your feedback. We do our best to respond to as many as possible. Your questions and comments help us improve and tailor our content to your needs. Until next time, stay healthy and curious. Keep exploring and learning about the fascinating world of health and medicine.